They would need to be able to come to the office the next day, because the next day we would see them. We usually take the dressing off and inspect everything. We would do some cleaning and show them how to clean it, because they're going to be doing post-op care for themselves over the next week. Typically we'll see them at about 3 days also, and part of the reason for that is because we want to check up and make sure they're cleaning properly, but also newer techniques with surgery involve a technique called a hemostatic net. And the hemostatic net procedure is sutures put directly into the skin, which help to tack the skin down into the position that we want to keep it in. Sometimes with all the swelling, the skin can shift a little bit, and we found that not only does it help to keep the swelling down and keep the skin in position, but it also reduces the risk of having some bleeding under the skin that can cause either the need to remove the blood under the skin, or even just cause some effect on the shape of the face that we don't want to have, and prolonged healing that can result from that. So on day 3, we will take out the hemostatic net sutures. That way they don't leave any marks in the skin, and then the sutures around the incisions need to come out on day 8. Restrictions after surgery for most of our surgeries is about 2 to 3 weeks. They need to avoid exercising, going to the gym, lifting more than 10 or 15 pounds, doing activities that would get your heart rate or blood pressure up, so that we don't have concerns about delayed bleeding or other complications that could arise from just being too active too soon. The average follow-ups after that first week after surgery is to see them again, usually around 3 to 4 weeks, just depends on what's going on. But 3 weeks is the point in time where the restrictions can be lifted if everything's healing well. And we usually will have them start doing some scar therapy to try to help soften the scars. And it takes about 3 weeks before an incision actually turns into a scar, before we can start doing some treatment to it to help soften it, and also where the restrictions are lifted. Just depending on how the person is recovering, we may elect to see them at 3 weeks or maybe 4 weeks. 4 weeks is usually a good period of time to get photos, first set of after photos, and of course, they're going to look presentable to the public usually at that point, but they may still be aware of tightness and some different healing sensations. The skin where we've lifted can feel numb for a while, and that can take several weeks to even up to several months for that to recover. But they can look very presentable and resume a lot of their normal activities even at about 3 weeks. I hope you've enjoyed this video. If you have any more questions or you want to make an appointment for a consultation, please feel free to contact us at newportfaces.com. Call us or text us at 949-566-1032.